Welcome everyone to the Interoperability Showcase. Our vignette highlights the full system response when our patient, Brenda Sanders, is exposed to tuberculosis while working at a free clinic supporting the unsheltered, and the impact of her infection on her latent chronic kidney disease. I'm Ben Cushing. I work for Red Hat, which supplies the underlying open source operating system and application platforms used by many of my colleagues. Please help us continue this important work by letting an ambassador scan your badge. This reference architecture shows the functional capabilities and connected systems we've specifically interfaced to demonstrate both the public health reporting and clinical care response. On the left side, we have a data transformation service, Fire server, a clinical decision support engine, a workflow automation designed to automate much of Brenda Sanders' care and provide consistent quality measures with adherence to clinical guidelines. And to the right, a system of record using an embedded application to automate the public health reporting through a number of public validation and analytics in support of the public health response. We're using this process automation diagram to help orient you, the audience, as we tell Brenda's story. So do check in with this screen if you get lost or just want to follow along. I'd like to thank the BPM Plus Health community for helping to build these process models and for continuing to improve patient outcomes through the promotion of shareable clinical pathways. All right, let's dive in. Our story begins with Brenda Sanders when she's exposed to tuberculosis while working at the Big Apple Free Clinic. The clinic administration has asked that all personnel report to the Occupational Health Clinic for TB screening and potential clinical interventions. My colleague, Brandon here is going to be playing Dr. Smith. He's from Oracle Health, and Brenda is symptom-free, but we still need to care for her. So Brandon, take it away.
Hi, my name is Brandon, and I'm with Oracle Health. We are representing the core EHR in this particular scenario that the Occupational Health Clinic would be using. As stated, Brenda has presented to the Occupational Health Clinic with a suspicion of TB. Upon intake, we are going to capture some of Brenda's demographic information. This includes, but is not limited to, address, phone number. We also are going to capture occupational data, where Brenda is employed, what her occupation is. We're going to also note her primary care physician as Dr. John Oates.
Yeah.
As stated, Brenda is seeing Dr. Victoria Smith today. Once she sees Dr. Victoria Smith, Dr. Smith is going to order a TB test and a renal panel. Additionally, Dr. Smith is going to add the diagnosis code of tuberculosis suspected to the system. Our system is enabled with the ECR Now Fire app, and the addition of this particular diagnosis will kick off the electronic case workflow. I'm going to now transition it to the public health platform.
My name is Joel Hartzell. I am presenting with the CDC team. Oracle Cerner is using the ECR Now Fire app, which uses the Fire R4 API to identify patients with conditions that would be reportable for public health and to construct the Fire EICR. This app is an open source and freely available to EHR industry partners to integrate within their product, which provides ECR capabilities and fulfills the certification requirements for ECR. Surveillance of health conditions is a core public health function allowing for monitoring, control, and management of conditions within the community. The reporting of conditions from healthcare to public health is mandated by law in all U.S. states and territories, with many jurisdictions requiring more than 200 reportable conditions be reported. Electronic case reporting transitions this historical manual process, paper-based process, to an automated generation and transmission of case reports from EHRs to public health agencies for review and action. As you can see here on the maps, there was a rapid increase throughout the COVID-19 pandemic of healthcare organizations implementing electronic case reporting. This rapid implementation has continued following the pandemic across healthcare organizations due to meet CMS promoting interoperability requirements for hospitals and critical access hospitals and MIPS providers. Each day we receive about 55,000 case reports from over 25,000 healthcare facilities that are delivered to public health agencies. Brenda Sanders' EICR from Oracle Cerner is received by APHL's informatics messaging Service or HIMSS platform, which provides a single point of connection from healthcare to public health agencies. The platform connects to healthcare organizations through networks like eHealth Exchange, Care Quality, or Commonwealth to provide a policy framework to enable sharing of data from electronic health records to public health. Public health provides trigger codes and parameters to be implemented within the system on how to trigger a report from the EHR through the electronic reporting and surveillance distribution. EHRs can automatically ingest this information to allow for rapid updates from public health when necessary. FHIR is being used to exchange data in the EICR, reportability response, or RR, bidirectionally between healthcare and public health. As the case report in this scenario is occupational exposure, the EICR includes occupational data, which is useful for New York City, which we'll talk about that here in a second. Useful for New York City to respond to this particular event. RCKMS evaluates the patient's address of residence and where the care was provided. In this scenario, both were New York City. However, it's possible that they would be different jurisdictions. This provides time savings when there is cross-jurisdictional reporting and ensures no cases fall through the crack. After identifying relevant reporting jurisdiction, RCKMS, or the Reportable Condition Knowledge Management System, evaluates the jurisdiction reporting logic and determines where it should be sent, if anywhere. In this case, RCKMS confirms that the diagnosis of suspected tuberculosis is a reportable event for tuberculosis in New York City and should be forwarded to public health. The RR contains this information about which public health agencies the EICR was sent to, and information from public health back to the healthcare organization about the condition that may be relevant to the healthcare organization, such as treatment recommendations or quarantine guidelines. The RR is sent back to healthcare organization, and the EICR and the RR are sent to public health. For this use case, a set of centralized services allow healthcare and public health to efficiently exchange data. This saves healthcare organizations and public health agencies time and effort. In particular, the use of this platform prevents every provider or facility from having to set up individual connections with every PHA throughout the country. This model saves us all time and effort. We'll now pass it over to New York City to see how they receive and use the electronic case report for Brenda.
Hi, my name is Angel Aponte, and I work at New York City's Health Department. I'm going to show you the electronic case report data flow in New York City. You've already heard about the electronic health record systems where the case report starts, and the HIMSS applied informatics messaging services. In New York City, we have some file pulling software that reaches through the internet into HIMSS and pulls the FHIR resources, adds them in a database, as you can see in number 4. And then we have some FHIR resource processing software that connects to a medical terminology database to validate the medical codes that are reported to us and places the information in a data analysis and quality assurance database. We have some analysis and quality assurance platforms via Python, RStudio, and Tableau to generate reports and analyze the quality of the data before we turn a reporting site on in production, where the data gets pulled out of the database through a Maven integration format generator, and the data gets added to the disease surveillance system database, where the disease surveillance application can then be used by surveillance staff to do case management and case investigations. This is what the FHIR resources look like when they're parsed by our system. You can see Brenda Sanders and her suspected tuberculosis and her suspected exposure to tuberculosis. You can also see that her occupation is an adult nurse practitioner. And you can see that the files that we received were the electronic case report and reportability response in FHIR via the JSON format.
Hi, my name is Caitlin Deviney. I'm also with the New York City Department of Health. Here is what the ECR looks like once it arrives into the New York City surveillance system, Maven. This is the event dashboard, where there are various question packages where different data are stored, as well as the basic information that shows general demographics for the patient. Any information regarding high-risk exposures is stored in the Congregate Exposure Sites and Risk History question package. Here we can see the information regarding the patient's status as a healthcare worker, including their occupation, type of business, name of the facility, and phone number. As EHRs conform to the US CDI standards in the future, we will be receiving more data elements, including start and end dates. Since this patient has been identified as a healthcare worker, the investigator will contact the facility to ensure proper isolation and infection prevention and control protocols are being followed. They will also initiate a contact investigation to identify and evaluate contacts, ensure appropriate treatment for contacts with TB disease, and assess whether testing of additional contacts is warranted. They will also be monitoring for additional TB cases associated with the Big Apple Free Clinic. Ultimately, data reported via ECR contributes to our efforts to detect and prevent TB transmission and reduce disease burden in New York City. Complete and timely case reports allow us to identify citywide transmission rates of TB in New York City and to better understand inequities in disease transmission. Detailed case reports can allow investigators to quickly identify the need for contact investigations in non-household and healthcare settings. In 2022, New York City conducted 132 investigations in healthcare-associated settings.
So the reportability response, or the RR that was created by the platform, is also inserted back into the EHR. So what Dr. Smith would see is a reportability response that confirms that tuberculosis was reported to the New York City Department of Health and Mental Hygiene. There's additional resources that Dr. Smith can access via this report to give her more information and to help close out this episode of care around tuberculosis. Earlier we talked about the renal panel that was ordered for Brenda. Some of those results are starting to come back in, and we note that there is an elevated or out of range creatinine level and EGFR. This data and other clinical and patient level data is made available by our platform via a FHIR interface, and we're now going to transition to the primary care workflow.
During Brenda's tuberculosis screening, the lab result reviewed abnormal renal function, especially abnormal serum creatinine. With the secure FHIR data platform exchange, Smile Digital Health's data fabric, and Oracle Cerner EHR, the lab data is now expressed as FHIR observation resource made available to the EHR for the primary care provider, Dr. Oates, and an automated notification was triggered. As a side note, for the demonstration purpose, Interoperability Institute Sandbox MELD was used. MELD is used for FHIR applications to test and validate their application with synthetic patient records. Now back to the story. In the context of clinical decision support, CDS, the newly found decreased kidney functioning with a calculated high-risk score, it triggered a need of a referral to a nephrologist. This is supported by Red Hat's Cogito process engine. Konica Minolta receives a signal from the process engine and generates a referral for Dr. Oates to review. Dr. Oates then reviews and approves this newly generated referral and faxes to the nephrologist, Dr. Nancy Wheeler, along with supporting documents and lab results. We're using fax as an unstructured data in this use case is because fax is still used very prevalent every day. And for the foreseeable future, we think fax is still going to stick with us. Dr. Oates then calls Brenda to explain the reason of the referral and any additional tests she may require. I'll let the nephrologist know and Konica Minolta to describe how the fax is processed and to continue on the care for Brenda.
So what we're looking at is Brenda's referral form from Dr. Oates that was created based on the abnormal lab work that was generated from Dr. Smith, the occupational medicine physician. And we're also showing here some additional diagnostic tests that were ordered by Dr. Oates to further justify his referral to the nephrologist based on Brenda's chronic kidney disease. These documents are all forms of unstructured data. So the Konica Minolta Connected Care platform takes unstructured data from varying sources, such as a fax, like we are demonstrating in this use case here. Then we take it and process it through our workflow automation platform and convert that unstructured data into structured data that can be ingested into an EHR or end data repository. What we're showing here is the back end aspect of our workflow automation. It's currently, we'll take the unstructured data that we had shown from that fax document over here, the referral, and we will extract discrete data from the referral. We will also then process through Brenda's labs and additional diagnostic tests. Our SaaS-based platform will then take this into an end user interface. This user interface is what the end user sees, and only this piece. The data here is editable for Dr. Wheeler's staff to take and review the referral that came in, make any edits, corrections, adjustment to meet their needs. This is all customizable to the needs of each individual organization, in this case, Dr. Wheeler's staff. We've built it for this use case to meet all the needs of our workflow. And as we save through each individual page, we are extracting the needed information to get into Brenda's chart, which will eventually end up with Oracle. We used JSON file formatting for this particular use case and then went through FHIR resources. We can also use HL7 data and standards, as well as other customized needs based on an organization's specific uses. We also, not only as we showed here, we are running one workflow for this particular use case. However, we can run multiple simultaneous processes based on, again, an individual organization's needs. So what I'd like to do now is pass it off to Red Hat. Thank you.
Brenda Sanders will have a follow-up with primary care in 6 months and follow-up with nephrology in a year unless symptoms worsen and are deemed necessary by primary care. As Brenda's TB is being treated and her long-term CKD care is established, the public health response issues corrective recommendations for the Big Apple Free Clinic to avoid infectious disease exposure and continues monitoring for threats to public health. Thank you for your time and attention today. We'll stick around for questions. We have a lot of experts here able to answer just about any question. If we don't see you during the rest of the conference, we hope to have inspired you to how technology, process, and people can have a profound impact on our lives. Have a wonderful day. Thank you.